We got a lot to do today, and it's 10 o'clock, so I think we should get started. We have 10 bills and like, what, 4 hours to do them in or something like that. So is anyone here to talk to us about Senate Bill 337? No. Oh, okay, here we go. Please state your name.
I'm more here to offer myself up for questions. My name is Rob Berry. I'm General Counsel of the Division of Medicaid. I did hear your conversation about how much Medicaid. I was trying to find that in the fiscal note worksheet from last session. I hadn't pulled that up yet, but it is correct that this was part of HB2. This part was left out of HB2 last year, and this is more of a cleanup piece of legislation. So I'm happy to take any questions you might have.
So speak a little slower.
Sorry. I'm also fighting a cold, so let me apologize for my voice. Last year,
Your name?
Rob Berry,
Rob Berry.
General Counsel, Division of Medicaid.
Division of Etiquette.
Medicaid.
Medicaid. Oh, I'm not hearing you. Yeah.
It's all right. Sorry. Yeah, my voice is.
Do you do hearing aids?
There you go. All right.
Fine. Thank you.
Last year, a bill had been introduced known as the Momnibus Bill that included this lactation and doula language. It had been incorporated into HB2. This portion here in SB 337 was inadvertently left out of the incorporation into HB2, and that's why we're here today. It's cleanup legislation to incorporate this provision. And this is necessary so Medicaid can be billed, is essentially it.
Okay. Committee have any questions for Mr. Berry? Representative Wiley.
What does a doula do that needs training and certification?
So I don't have my licensing person with me, but my understanding is a doula is somebody who's specifically trained in providing childbirth services and aftercare as well.
So Carol talked to me about this because I think this came from her committee, and she said that often young mothers sometimes don't have their mother around or don't have some experienced woman around to help them learn how to breastfeed correctly, I guess. And that's what the purpose of these people are, correct? Yeah.
Yes, it's more focused on the aftercare, I believe, after birth.
Representative Evil, did you have a
Yes,
question?
I don't have a question. I mean, I'd like to make a motion to pass the bill.
Go ahead.
OTP. Thank you.
And there's a second from Representative Sweeney. Any discussion? All right, clerk may call the roll.
Okay. The clerk just made the motion, so I'm going to get my act together here. Hang on.
Okay.
So the motion is ought to pass on HB 337. Representative McGuire.
Please call me last and call Representative Griffin first.
Okay.
Okay.
Representative Griffin.
Yes.
Representative Sweeney.
Yes.
Representative Cambrils.
Yes.
Chair Weiler. Clerk votes yes. Representative Lane.
Yes.
Representative Grassi.
Yes.
Okay, this is gonna get all screwy here. Representative Wallner.
Yes.
Okay, and Vice Chair McGuire.
Yes.
Okay, all right, so it is 9-0 unanimous. Ebel, Sweeney. Okay, thank you.
Due to scheduling weirdness, our next one is not scheduled to 10:20. So I don't know if that, are we obligated to wait or? Yes. Okay. Oh, well.
It's in the calendar.
I'll just mention something about this bill that sort of bugged me, okay, since we're sort of on this bill. And that is, where is it here? Or maybe it wasn't this one. The office. Yes, so it's line 11. The office shall make every effort to include racially and geographically diverse community members and providers. So this to me reads like it's unconstitutional, right? The one we're talking about, 337. Duelist, yeah, the one we already decided to pass. But this is just the line that bugs me, is that shall include, they're supposed to use race, right? But don't we have all kinds of laws and so on that says you can't use race for stuff? Exactly. So I'm not comfortable with that, but I just mention it because I don't think it's going to make any real difference. Yeah. Yeah, it's just, all my amendments for today have to do with money, so that wasn't money, so, you know. Yeah, I guess. Could do a floor amendment. Anyways, that's that. All right, we'll see you at 10:20. It is 10:20. Is anyone here to talk about Senate Bill 369? Office of Professional Licensure and Certification, providing notice of public meetings and an opportunity for comment, creating a new position, and making an appropriation therefore. All right, please come forward and state your name.
Good morning, members of the committee. For the record, Lindsay Courtney, Executive Director, OPLC. So as you recall, this is very similar to the bill that you passed last year, which was House Bill 337, which the governor vetoed, citing some concerns specifically with administrative burden and deviations from 91A. What we did is we went back to the drawing table. We made a few changes, and I think it's something that we can all agree can work. And we take no position on the bill, but we're ready to implement it should the legislature decide to pass.
So any questions for Ms. Courtney, and congratulations on your upcoming promotion there?
Thank you very much, Representative.
Yes, Representative Sweeney.
I would move on to pass.
Okay. All right. I guess there's no question.
Okay,
All right, the clerk can call it a roll.
okay, hang on just a sec. Uh, 369 OTP. Okay.
When will that happen? Do you have to go to executive council? Yeah, not yet.
All set? Okay, the motion is ought to pass on HB 369. Representative Griffin,
Yes.
Representative Sweeney,
Yes.
Representative Cambrils,
Yes.
Chair Weiler. Yes. Clerk votes yes. Representative Lane,
Yes.
Representative Grassi,
Yes.
Representative Wallner,
Yes.
Representative McGuire.
Yes.
Okay, 9-0. Sweeney and I.
And Eagles.
All right, do we have another 20 minutes?
Yeah.
No, 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 no.
Excellent. All right, so we are on Senate Bill 403. Yes? Anyone here to talk about that? Senator Oswald? No? Yeah, do you want to tell us what this is about?
This bill before you, thank you, Mr. Chair, is a stripped down and stripped down policy-wise and cost-wise version of what was introduced in the Senate. It does basically three things. It extends the Commission on the Primary Care Workforce, which is about to expire. It allows more LNAs to administer medication. And it sets up a process for voluntary certification of community health workers. These individuals are really important to the healthcare system, but they are not clinical staff. They are personnel who have sort of lived experience with the communities they work in. They work in community health centers, hospitals, and at least in Nashua, they work in the public health department. And what they do is they do a lot of the administrative work so that licensed healthcare professionals can actually work to the scope they are licensed for. So doctors and nurses don't need to be arranging transportation to medical appointments or helping with food assistance. That is the job that a community health worker can do. So the nurse and the doctor can do nursing and medicine. However, because they are not certified now, they are not able to be reimbursed by either Medicaid or commercial insurance. So by setting up this process, they would become able to be reimbursed. In the commercial market, of course, that would be subject to contract negotiation between a carrier and the employer. We also took the appropriation to sustain this important workforce out of the bill because the Department of Health and Human Services already has the money they need from federal grants. And in fact, last month in the fiscal committee, we transferred just under $2 million to support the community health workers. So there's no state cost. It is not an ongoing solution, but the hospitals, the family resource centers, the community health centers think they're a really important part of their workforce and would like to be able to keep them so that physicians and nurses can work at the top of their scope. Thank you.
It's from the committee. Yeah, Representative Wallner.
Thank you. Senator Rosenwald. So the bill will be funded through ARPA funds that fiscal has already acted on. Is that correct?
I don't think it's ARPA funds. I think it might be a different federal grant, but it will be funded through federal grant funds that HHS already has. That's why there's no appropriation. We were able to take it out because the department had the money and we've already transferred most of it to fund this workforce for the next year.
Thank you.
Representative Wallner. I said Representative Weiler, excuse me.
Thank you, Mr. Chairman. Thank you, Senator. When I first read it, it sounds like this is dealing with foreign populations, but there's no requirement to be language proficient to get this certification. And do we have that many? Is there that large a foreign population that can't understand English?
Well, 10% of the population of Nashua is from India. We have also a large and growing Latino population, and I moved to Nashua 35 years ago, and there was a significant Brazilian population at the time. It's not only language based, it's communities of elderly people who are more homebound who are also helped. And it's also young families who are more at risk, who are clients, let's say, of the family resource centers. So I think it would be not correct to say we're only talking about people who speak Spanish. It's some people who speak Spanish, but it's some people who know the community, some people who are good with the elderly or with young families.
Thank you.
Right. So Senator, Melissa, give her the latest fiscal note. Oh, she has, okay. So what I'm concerned with is if you look under expenditures on our, as amended by the House fiscal note, which we just got, it says in 2025, 4.25 million source federal ARPA funds, state general funds. And the way I read this, that's an ongoing cost. Is that right?
Well, it's a subject to a budget appropriation like everything else in the next budget. So I don't read it that way.
Oh, so you're thinking that we could pass it now, they could work for a year, and then we could pull their funding back? I mean, that seems...
I think we could, hope that we continue to get federal grants. We could discuss using general funds. We have all the options that we always have at our disposal, but their grant funding that they currently have runs out like next month. So this will keep them employed for the next year, and then all the options are ours. We might decide not to include their funding in the Medicaid budget. We might continue to receive federal grant money. I mean, I just don't think we can predict that.
Okay. Representative Walner.
So it sounds to me like from your description of the work that the community health workers do, it sounds to me like that actually, as far as the Medicaid budget goes, they're providing, I'm sure, at a less reimbursement than a nurse or a doctor. So in a way, they are saving healthcare money.
I think you could look at it that way. I mean, right now they're getting zero reimbursement. So this would allow, and we've already transferred for federal funds to help sustain this workforce in the short term. By increasing the availability in the primary care setting, I think we save money through the entire healthcare system. So if doctors and nurses can see more people at a community health center, I think we could project, I don't have the numbers, but I think we could guess that might mean fewer emergency department visits, fewer hospital stays. So I think it's a logical assumption.
What would happen if we delayed this issue till the budget next time? Where it could be considered by Division Three, more properly than us.
Well, I think that we would lose the services of these workers for the next fiscal year because we've made the money available, but we haven't started the certification process. If we delay it till the next budget, it won't just start on July 1st of 2025. We'll be 3/4 of the way through the next budget before those rules are written and adopted. So I think that it makes sense to do this policy piece now, knowing that there is not a state cost and we have the option to fund it or not fund it or fund pieces of it in the next budget.
All right. So I prepared an amendment that would, thank you, Senator. I prepared an amendment. Is there anyone, by the way, from HHS here? Yes. Would you like to come and talk? Okay. Yeah, could you? And state your name, please.
Good morning. My name is Athena Cody, and I'm with the Department of Health and Human Services Division of Public Health.
And I'm Krista Morris. I'm with the division, Department of Health and Human Services. Sorry, I'm tired.
Thanks. So please, the two questions I mainly asked the senator, I would like you to confirm. Is it so that there is no general funds in this bill for this budget? That the money has already been provided by the fiscal committee or is from internal money that you already have extra?
There's no addition. Oh, sorry, I didn't realize how loud that would be. The current funding is already appropriated within contracts, and through fiscal year 25.
So through the end of the current budget?
Yes.
Yeah, okay.
Yes.
And what would be the consequence of delaying the certification to the next budget? Essentially putting this language in the next House bill too?
The certification piece, from my knowledge, has been an ongoing work. That has been something that we've really tried to look at happening. But it's a way for reimbursing for services and not being solely reliant on grant funding. This would allow some Medicaid reimbursement. It's not going to cover all of the FTE or the full salary for a community health worker, but it'll at least help to for these agencies like the community health centers and family resource centers to be able to start planning some other sources of funding. This will definitely help to reimburse for some of those services ongoing. So it kind of sets us up a little bit to future planning.
Representative Wallner? Yeah.
So presently, if these community health providers are not certified, they're not eligible for Medicaid reimbursement. So we do not receive the federal share.
Currently, there is no certification, but in the future, it's totally voluntary. So if a CHW does not go through the process, they would not be eligible for Medicaid reimbursement. And so the Medicaid reimbursement does allow for some guidelines that could be monitored.
Okay, and so just so I'm clear, in order for a community health worker to be reimbursed with Medicaid funds, they have to be certified. Is that right?
This would be the process, yes.
And this is the process.
Yes.
Thank you.
Yeah.
Who's providing the grants that are paying them now?
There are a variety of grants, some from the Center for Disease Control, Health Disparities Grant, some are epidemiology and capacity building. I didn't write all the grants down, but there are various federal grants that also come to a close, and so we are interested in sustainability of the workforce.
So you don't expect to get these grants continuing?
No,
And that's why you want to move these people on to being paid by Medicaid?
yeah, these grants are all coming to a close. Right now, we're in a we've had approval for a no cost extension for a couple of them, so they'll end.
Okay. So is it fair to say we're making a decision here as to whether, if we continue this workforce, the state will end up paying half, because we pay half of Medicaid, versus right now, the state's not paying general funds for this?
So in our fiscal note, it actually states that the 4.2 million that are currently being used is a mix of federal and general funds. So right now, some general funds are being used.
That were in the budget, or?
Yes.
Oh, okay. I see.
Just to clarify, the general funds are some of the funds that go to family resource centers, which supports a variety of their infrastructure. Some of those are if they need coverage for those positions, for the CHW positions.
Is that about half of these costs, or is it a little less? Or?
No, it's a lot less.
A lot less.
Primarily, they're federal.
Okay. All right. Any other questions? No? Anyone else here like to speak? I see a hand back there. Thank you, ladies.
Good morning, Mr. Chairman. I'm Jim Monahan with the DuPont Group, and I'm here today on behalf of a number of community providers. We have a coalition that's been working on this subject matter and bill for a couple of sessions. So I don't want to lean in heavily on the policy because I know you're looking at the fiscal impact. But so let me try to convince you not to move forward with your amendment, Representative McGuire. Particularly how it will affect the community mental health centers and the community health centers, the federally qualified health centers. They employ lots of community health workers. It accelerated a lot as a consequence of the healthcare workforce shortage that we've had. As Senator Rosenwald indicated, with the right balance of community health workers, you're able to free up clinical staff to have more direct contact with folks. So today, those community health workers, because they don't have a certification, they cannot be credentialed by commercial insurers, and so their activity at a community health center or community mental health center is totally paid for with the center's bake sale funds. I know that's not a fair way to describe it, but there's no commercial or Medicaid reimbursement for that activity. So that is among the. There's certainly other reasons around the professionalism of the workforce, so they stick around and they become part of. They work their way through it. So the concern we have, and as the Finance Committee is well aware, is that there is a significant challenge to operate the community mental health centers and the community health centers. So this is going to help both from the professionalism of that workforce, but frankly, with regard to reimbursement. I don't think we'll be in a situation where if we don't move forward with this, we'll just eliminate that workforce. What we're really doing is just leaving money on the table, whether it be for commercial reimbursement, for Medicare or Medicaid, without the certification. So we try to work this through the system. It is a voluntary certification, so we're trying to be mindful of not expanding regulated health professionals if we don't have to. But it really gets into this odd mix of the rules of the road for reimbursement.
So are the skill levels of this group less than an LNA?
Yeah, I want to be respectful of the profession, but yes, I mean, they're
So
not.
someone from this group might future move up by becoming an LNA.
Oh,
for
absolutely,
example.
yes.
Yeah.
Yeah.
Okay.
That's
Thank
part of you know, I don't want to have this, not the policy committee, but the whole theory around the career ladder, that you bring people in the early stages of the career and encourage them to be trained and move through the process.
Thank you. So would anyone like to make a motion on this bill?
I'll move ought to pass.
All right, is there a second? All right, the clerk will call the roll.
All right, the motion is ought to pass on HB 403. Representative Griffin,
No.
Representative Sweeney,
Yes.
Representative Cambrels,
Yes.
Representative or Chair Weiler. Clerk votes yes. Representative Lane,
Yes.
Representative Grassy,
Yes.
Representative Wallner,
Yes.
and Representative McGuire.
No.
So the vote is 6-3. All right.
Relative to real estate practice. Relative to real estate practice. Anyone here to speak about this one? All right, I see a hand. State your name. We have a new fiscal note. Thank you.
I know.
So good morning, I'm Adam Schmidt. I'm a lobbyist here in Concord. We represent the New Hampshire Association of Realtors. And as I'm looking at this, it says exactly what I hoped it would say, which is there is no fiscal impact. At the policy committee, there was a provision that talked about allocating funds to OPLC for additional staff. That section was removed in ED&A. So the portion of the bill that actually spent money was removed. All that's left are policy provisions that are very technical and deal with the real estate practice, which would just be very boring to have me listen. I would try to explain. But for this committee's purposes, the portion that did allocate money was removed from the bill as introduced. All that was passed on to you were, again, some more technical corrections for the Real Estate Practice Act.
Thank you. Any questions from the committee? Representative Griffin.
Well, I kind of want to offer that I have had a real estate, or I had a real estate license from age 19. And so I looked at this bill pretty carefully. It makes some positive changes. It appears that it eliminates the need to maintain an office and a bond if you're inactive. It also states that if while you were active, if you earned a commission, that can be paid if you become inactive. The commission for the time you were active can be paid. And other than that, basically, it appears to me to be a lot of the things that existed already. And I would move on to pass on it.
Representative Griffin has moved on to pass, seconded by Representative Sweeney. The clerk will call the roll, assuming there's no discussion.
Okay, Representative Griffin,
Yes.
Yes. Yes.
Yes.
Representative Grassy,
Yes.
Representative Wallner,
Yes.
and Representative McGuire.
Yes.
Okay, 8-0.
We'll come back at 11:20.
Yeah. Da da da.
Yes, thank you. So it's 11:20. Let's get started on Senate Bill 407, establishing a ground ambulance cost, reporting program, etc. Has no fiscal impact, according to our latest as amended by the House. Anyone want to tell us what this is about? Because I tried to read this and I couldn't understand it. So all right, yes, please come on up. And state your names. Thank you.
Good morning. I'm Michelle Heaton. I'm the Director of Life and Health at the New Hampshire Insurance Department.
And I'm Alex Feldwebel, the health reform instructor at the New Hampshire Insurance Department.
Welcome. What can you tell us about what this does?
Well, I'd like to start by taking a couple of minutes to give the whole context out of which this bill came.
Absolutely.
It comes out of a series of meetings dealing with ground ambulance services and their interface with commercial health insurance that started last summer. The insurance commissioner convened what we called the Ground Ambulance Summit. And we had a lot of representation from ambulance providers, from hospitals, consumers, and health carriers to deal with two main issues. One is the problem of balanced billing, where people who are covered with health insurance get surprised by a balanced bill for ambulance services because they don't realize that the ambulance is not in network and therefore not constrained by the reimbursement amount that it receives from the health carrier. It's the one area that was not dealt with by the Federal No Surprises Act because it's a little bit more complex than the other instances of balanced billing that were occurring. So that's one problem that we wanted to solve. And the other problem was the increasing financial strain that ambulance service providers are under these days. Their costs are going up a lot. Traditionally, the public payers have not paid very well relative to the cost of producing the services. So we were trying to tackle those two issues at the same time. And the department, we sort of finished up with the meetings. We couldn't reach consensus as a group, but the insurance department did produce a report, a final report on the summit meetings, which is on our website. And the essence of our recommendations were basically the commercial insurers, because that's what it was about, is that percentage of the payers that ambulance service providers have that consists of state-regulated commercial insurance, which is really only 10% of the payers. Most of the payers are Medicare, Medicaid, self-funded commercial coverage, which is not regulated by the state, and then the last 10% is the commercial insurance. So our recommendation is that 10%, the commercial insurers should increase their reimbursement rates to fully cover the costs of providing ground ambulance services, including the cost of what's called readiness, of making sure you have sufficient resources to be available. And number two, that balanced billing should be prohibited in exchange. But in order to determine what that cost-based fee schedule should be, it requires a study. That information, we made a sort of layperson's attempt during the summit meetings to put out a survey and gather some information, but we didn't get usable information in that way. So what's needed to move toward this cost-based reimbursement system is a professional study with an actual cost survey done by an accounting and actuarial firm, plus the production of a report and an illustrative fee schedule. So when House Commerce got this bill, out of all the recommendations that the insurance department has made, they picked out that one piece, like the first step, and decided, let's just do this. Let's do it quickly. So it's due December 1st of this year. which is indeed a tight schedule. But that's how this replace all amendment came to be. I could pause there, or I could anticipate questions.
So, yes, let me just quickly, the previous fiscal note said that we were raising people's insurance costs by $11.8 million. So that's gone, is that what you're saying?
Yeah, the version of the bill that came over from the Senate was quite different. It sort of jumped over the cost study and just picked a number, which was basically either whatever ambulance providers charge or 325% of Medicare. And so when we had to do a fiscal note for that, and from our claims data, which we used to do a lot of analysis, we saw that the current rate is more like 120% of Medicare. And so we just used the claims data to calculate what the total cost would be to bring it up to 325%, and then what that would mean on a per member per month basis for premiums, which was $4.41.
Thank you. Questions from the committee? Representative Lane.
I don't have as much a question as I have experienced the balance payment. And considering that we had no choice in who we picked, it's a huge issue for people. So do you think that this is going to lead to a solution of that? Because it was a big surprise.
Well, I appreciate your comment.
2 big surprises.
We get a lot of complaints. In the last 2 years, we surveyed all the complaints about balance billing. We found that the median balance bill was between $3,000 and $4,000, and that 30% of them were actually over $6,000. And when you compare that to the fact, the New Hampshire Fiscal Policy Institute reports that 27% of New Hampshire residents have less than $2,000 in emergency savings, it's a real hardship for some people, certainly. And it was a top priority of the department to get to that issue.
Yeah, and I think when we've been talking about this issue throughout the summit and throughout this legislative session, trying to come up with compromises, the sticking point is always, well, what percent are you going to set it at? What's the rate going to be? And I think all the parties are at very opposite sides. So this independent analysis will help everyone come up with an agreed upon rate that is based on data and based on actuarial principles.
More questions? No? Maybe Representative Lane would like to make a motion? Oh, you can't as a sub? All right. Oh, thank you. Okay. And seconded by all right, so Representative Grassi moves and Representative Sweeney seconds ought to pass. The clerk will call the roll.
Representative Griffin.
Yes.
Representative Sweeney.
Yes.
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 Representative Grassi.
Yes.
Yes. All right, thank you very much. It's 11:40, and we are going to consider Senate Bill 487. I see Commissioner Arlinghouse here to talk to us about. Yes, please. So you're going to explain why we're going to have to spend $350,000 a year instead of $72,000 a year just because people are moving from one building to another.
Well, it's not quite like that. The bill, first of all, it's worth noting that there's no appropriation attached to this bill. I don't want anyone to think that, I don't want the PAB in particular to think that they will get staff, because until money's appropriated, nobody gets nothing. Because there's no appropriation in the bill, near as I can tell. The additional money is an estimate of what an independent PAB would cost, and it presumes they have a couple of people. And that they're, right now, basically the way the Personnel Appeals Board works is it's an appellate body that is fundamentally independent, but not legally independent. It's an afterthought of state government, like a lot of these little things are. They're just sort of an afterthought, and you're like, well, we're not really in charge of you. And you could argue, for example, they rely upon the good graces of the Division of Personnel to let them use their conference room and supply them such staff as might have free time to help out with various administrative duties. And that's always been a source of some degree of tension, right, between the two organizations, particularly given that we are typically on one side of their decisions, right? They're deciding between an opinion that often includes DOP and somebody else. So it's sort of one of these awkward things, like, I don't work for you. No, I know you don't work for us, but, if you want to use the conference room on Wednesday, you got to ask somebody. And so there's all of that. So for a long time, they've wanted to be independent. This is something the board itself has wanted for a long time. And so they did. So what does independence look like? Independence looks like you are actually an independent agency. Like a lot of other little tiny things that are attached to, in most cases, unfortunately, us. But like the Commission on Aging has 1.5 people. The Child Advocate has, I think, 6 at this point. The Special Ed Advocate has 1, soon to be 2. The Conservation Land Stewardship, it's not trust. I think just Conservation Land Stewardship, the sort of flotsam that when we abolished OSI was left over. Someone went, oh, make them independent and attach them there. Well, what that happens is you get assigned state office space. And the way state office space works is you get charged for it, a rent-like charge. And so that's an allocation. You get a DOIT allocation for the computers that you use. And so that's all those costs amount to about this. I think our fiscal note, it's not the fiscal note, but if you looked at the fiscal note worksheet that was provided, it has footnotes for where all those costs come from. Like the personnel line would be 2 part-time positions. There'd be some expense to put a desk and a cubicle in an office, to set up a room. There'd be a copier, a printer. You'd have HR support, and then just those costs. Right now, the costs are only this very direct costs allocated to the PAB members in one accounting unit that happens to be carried within the DOP part of the budget.
Did you have a question? No. Questions? Representative Weiler.
Just a comment. I've been impressed with how often conference rooms can be multi-used, because, once a month, once a quarter, it's pretty expensive real estate to just one agency.
No, I think it's an important thing. You probably know this, that I've said from the beginning that from when I started that there's no such thing as a DAS conference room. That we have 3 conference rooms that our agency sort of controls the scheduling for, and they're routinely. Human Rights Commission used to always meet in room 405 of the annex, which is quote unquote our conference room. And I remember saying that to agriculture once when somebody wanted to use their conference room. I said, it's not yours, it's the state's. And so generally, and where I would like to get eventually is where adjudicative bodies, because there are a lot of little, if you think about it, the state, these administrative, the PELRB is one, and the Human Rights Commission has hearings, and that although they're very independent minded, so they're probably won't play ball. But Housing Appeals Board, and it's another thing that's attached to admin services. But there are all these little things, and nobody uses nobody uses a hearing room 5 days a week. And so PUC, for example, has 2 big hearing rooms. The one of them they let everybody use. PAB actually has hearings there sometimes. The other one they tend not to let anybody else use because it has nameplates and they don't want anyone messing with their stuff. But I want to get to the point where there's a building that has all the boards of various sizes and has like 2 rooms that everyone has to reserve, and that nobody gets to leave their papers behind, have to take them home at night or put them in their office down the hall.
Yeah, and you're redoing the building, right? So everybody's moving out soon anyways, yes?
The annex is about to, I'm told the first sledgehammer swings June 1st. Contract's done and people are moving out already from the annex. Admin services will have, there's seven different agencies that have people in the building. And admin services will have about 108 to 115 people move out, and about 30 of us left behind. The Secretary of State, is one of those agencies that's very hard to exercise any control over, does not want to leave, so they won't. So they're going to stay. Treasury's going to stay. The governor's office, I don't dare touch. So their suite of offices over there, they're staying too. That's sort of obnoxious. I don't mean I don't dare touch, but you know, I'm appointed by the governor. I'm not going to touch him. 33 people moved to Pillsbury, the Van McLeod building. Old labor in the budget if you're historically minded. And we're moving 80 of them to the Space Corrections abandoned in the main building. So we did some painting and stuff and vacuuming, but it looks nice.
So, all right, so if we pass this bill, can we expect in the next budget this agency's cost will go up and yours will go down by a similar amount or not?
No, ours will not go down by a similar amount because right now they would be a real independent agency that would get their own office space. Arguably, they're entitled to it now to an extent rather than being vagabonds just setting up in a conference room. Ours won't go down simply because the people who are helping PAB right now are not dedicated to helping PAB. They're staff who do, like, well, let's have Linda do it this week because she has time, and why don't you do the scheduling, and why don't you help with this? And those people all have, jobs where they don't have any free time anyway, and you're just hoping that on Wednesday they can do that. So you won't really see you won't see any reduction in our budget. You'll see an increase in theirs.
Can't you reorganize those people slightly so that rather than this week it's this person and this week it's that person, it's always this person and the other people fill in? No?
We could, but the truth is that to support PAB, we don't have sufficient staff now. And so what we're doing is doing the best we can. And so what you're asking everybody is it's essentially if I walked in and said, you know what, you guys have to support the PAB. The 10 of you, 10-ish of you, or many of you there are. And you're like, well, look, I got stuff to do. And I said, yeah, tough, cancel a hearing and make time. And so what we're doing, and I'm not saying that's a bad approach, but it's what we're doing now when someone said, I know you don't have enough hours in the day to do your job today. I don't care. I need 5 more of your hours in a week. And everybody's going to do a little so we get there. When everybody stops doing that, they just have time to do the things that they're ignoring now.
Other questions? No? Anybody like to make a motion on this bill? Representative Griffin.
I'll move on to pass.
Okay. Representative Griffin moves ought to pass and Representative Ebel seconds. You can call the roll.
Representative Griffin,
Yes.
Representative Sweeney,
Yes.
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 Representative Grassi,
Yes.
McGuire,
No. adjourn until 1 p.m., I think. All right, please stay in your places, and I will speak to the powers that be. Good. Thank you for coming. So we're going to talk about Senate Bill 134. Is anyone here to talk about that? Besides Marty. All right, Marty, it's you, I guess.
Thank you, Representative McGuire. I appreciate, for the record, my name is
You're
Marty-
welcome, Mr. Carlin.
Marty Carlin, representing NHRS. We don't have a position on the bill. I know this is a workshop, but there's a lot to this bill, and there's also revised fiscal analysis. So I wanted to come up and kind of give a summary of what the handout was that you just received. And then the last page is just hot off the press from the actuary yesterday and sent over to LBA after hours yesterday, so it hasn't caught up with the bill yet, for a fiscal note. So essentially what Senate Bill 134 would do is create a new level of disability benefit in NHRS for Group 2 members violently attacked and injured on the job, by means of a deadly weapon. Right now, there are two existing types for both member groups, job-related and non-job-related disability. There's different eligibility and different benefit provisions for each of those. They're referred to in the statute as ordinary, which is non-job related, and accidental, which is job related. It doesn't have to be an accident. That's just the way the statute was constructed. So this would create a violent accidental disability benefit. The bill has been amended significantly since it was first introduced last year, and then we referred to Senate eDNA, and NHRS worked with Senator Birdsell and other agencies on the wording for the current bill. Primarily, one of the largest sticking points was the eligibility. What is the definition of a violent assault, and who attests to that? So the Department of Safety graciously agreed to do that review. The commissioner already certifies for line of duty death benefit lump sum payments under a separate statute, as well as some other pieces. So that took away an administrative issue for NHRS. The benefit amount formula is different for this benefit. And again, this is a fiscal committee, so I'm not really going to go into huge detail here unless anybody has any questions. And there are a couple of other changes, including the eligibility for a medical subsidy benefit for these disability annuitants and/or eligible family members. So that's the gist there. The fiscal analysis, the original bill, it was sufficiently vague enough where the actuary estimated a very high number of accidental disabilities would be qualified under this. I think it said like $10 million or something, and that's not true. What the most recent did, and this number is, again, we'd have to look on experience and see what's going to happen, and it is sort of scalable in your own mind if you want to look at it and say that's too high. But they assume that 10% of Group 2 police job-related disabilities would fall under this, and that may or may not be too high, but we had to pick a number as a baseline, and 1% for fire members. So that's what the cost is shown on the last page here, pension results, state and political subdivision. So for instance, if you thought 1% of disability annuitants would get this instead of $40,000 a year for the state, it would be $4,000 in extra contribution. So very, very linear calculation to think about that way. Right now, there are currently about 445 accidental job-related disability annuitants currently receiving a pension from NHRS. 85 of those have retired since 7/1 of 18, which is the look-back date in the bill for anybody who's currently retired who thinks they may qualify for this can reapply. So that's the entire universe of people who could. There may only be, there's a couple of folks who have testified in previous hearings, and they may be the only ones, or there may be others unaware of it or outside the loop. We'd have to review all the records to see, but that's how that works. Our longest Group 2 disability benefit annuitant was disabled in 1968, and we've had about 150 prior to the year 2000. So, it's a small pace of folks who are even just injured on the job in terms of disability grants year over year, and this would be expected to be significantly rarer occurrence. So with that, I'd be glad to answer any questions.
All right, well, I definitely appreciate the smaller number, but even so, you said you picked 10%, and so 10% of this 70 number would be about 7. And as I understand it, only 2 are known, right? After a lot of looking, they found 2. Is that correct?
Yeah. Well, this projects going forward as well.
Oh, I
So,
see.
so in other words, there's 340 police and 100 fire currently receiving disability. So, 34 out of 10% of 340, because, hopefully this is a rare or non-occurrence going forward, but certainly by the nature of the work, they're projecting, future folks qualifying for this benefit as well. It's not just analyzing the retro piece.
Thank you. Other questions for Mr. Carlin? I'm not seeing anybody. All right. Thank you. And as I understand it, this is not directly charging general funds for, it's not like our other retirement stuff where we wanted to sort of pre-fund the existing condition, right? This is really adding to the unfunded liability.
Into the rate, yeah.
So, yeah, all right. Okay. Anyone else wish to talk to us about, yes, I see a hand in the back there. Thank you, Mr. Carlin.
Thank you.
There we go. My name is Paul Lewis. I'm medically retired out of Weir, New Hampshire. I'm one of the 2 officers that we know of that would directly benefit from this bill. Just to go off the number of 2, New Hampshire is a very small law enforcement community. There's 3 things that can happen if you get a gun pointed at you, right? You can either pass away, you can either, very fortunately, have very minor injuries, which then you could return to work, which does happen. And then in my case, and Dan Doherty's case, the other officer, you have to medically retire due to the severity of the injuries. When that happens, we are a community that looks out for each other. Anytime there's a big news story, we're right on it. Dan reaches out to me, and I reach out to the next person. There's been no one after me in New Hampshire that has had to medically retire after a violent injury. There has been in other states, and I've reached out to the officers in the other states, but not yet in New Hampshire. For me, about this bill, this is very important to me. I was working in Weir, which even with a college degree, I was making $21.50 an hour. When I medically retired, my pension went to $29. And with like the raise of inflation everywhere, it's just unsustainable. And on top of that, I'm capped at making $19,000 per year. So it's a very small number that I'm forced to live off of right now. And I don't get health insurance. I went in front of the town of Weir asking for help with that, and they said it's too expensive, go to the marketplace. So now $300 a month from my $2,400 that I'm making is coming out of that, and the number just keeps dwindling, and it's very hard for me right now. So with this bill, it would help me, and it would help a lot of future officers if it were to happen to them that are in a similar circumstance. But in 100 years of New Hampshire law enforcement, it's 2 that we certainly know of. So it is rare, but it will hugely impact those people that it do help. So we're hoping that you understand how helpful this bill can be, and I hope that you can think about passing it.
Thank you. Questions for Officer Lewis? Yeah, I'll just ask one, if it's not too personal. Looking at you myself, I would say you look like a person who could work. Is it that serious? What happened?
Yeah, so I was hit with 2 bullets in my dominant arm. And after the nerve injury, I've had 5 surgeries to try to fix it. My dominant arm is at about 5 to 10% use. I can't write without assistance. And it's been 4.5 years for me, 5 surgeries. And every time I go forward in my progression physically, something happens. Like, in fact, 2 years ago, I was throwing a ball with friends and my bone rebroke where I took the bullet. And then I went into my 5th surgery and they found a staph infection. So for that time, I needed 6 weeks of an IV on top of an arm that just had surgery. And it just, things keep happening. And that's like particularly why this is also important. Dan Doherty, he's had 19 surgeries in the 10 years. So we want a separate tier because these are lifelong injuries that keep having setbacks for us. And we wish it wasn't that way, but due to the severity, it's just what happens when you're violently injured.
Thank you. Other questions? No, thank you very much for coming.
Thank you.
So would someone like to make a motion? Representative Sweeney.
Mr. Chairman, I move ought to pass.
All right. All right, well, I heard the Representative Griffin first, so Representative Sweeney moves and Representative Griffin seconds, ought to pass, and the clerk can call the roll. And I'll remind people you will need blurbs if you make a motion.
Representative Griffin,
Yes.
Representative Sweeney.
Yes.
Representative Cambrels.
Yes.
Chair Weiler. Yes. Clerk votes yes. Representative Lane.
Yes.
Representative Grassy.
Yes.
Representative Wallner.
Yes.
Representative McGuire.
Yes.
Okay. 9-0.
Probably early. 8 minutes.
Okay.
Okay, it's now 1:20 p.m. and we're here to talk about Senate Bill 476. Shall we start with you, Commissioner? Thanks for coming.
Thank you. Good afternoon. For the record, my name is Helen Hanks. I'm the Commissioner of the Department of Corrections. I thank you for the opportunity to talk about Senate Bill 476. The Department of Corrections has been mindful in all that we have done in asking for capital budget infrastructure, but we're really at a point on behalf of the state where the New Hampshire State Prison for Men needs a replacement. And through my experience in different capacities within the department, including the New Hampshire Correctional Facility for Women, waiting for litigation, to be proactive, to be involved, to move a project forward is not the way to move forward. And when we asked during the budget phase for the initial costs to do the groundwork so that we really know firmly how much a replacement facility would cost the state, is really the right place to begin. And the $10 million, which we appreciate, is really not enough to do more than the geologicals. And we need to, and we're asking for the auto pass on Senate Bill 476 to get the rest of the initial industry standard costs, to do the bid spec documents, to do the staffing analysis, do the population analysis, all of the front work necessary to lean into this project in a way that's proactive. I know the number that we're currently forecasting for a replacement facility is a large number. I respect that. But even if you just turn to slide 5 on the informational I sent out, every time I turn a corner, even this last nor'easter we all experienced in April, the electrician that is familiar with our infrastructure at the New Hampshire State Prison for Men literally said, you need to replace the complete electrical infrastructure at this institution. The linear feet cost of that is not worth investing in. Investing in a replacement facility that is proactive for the air quality of the staff that work in that building, to promote retention, and create a healthier environment when the research already affirms that working at a correctional facility is dangerous, it is stressful. We can do better. And then in addition to continuing to improve the environment, because our mission is rehabilitation for those that are incarcerated there. Reception and diagnostic was built in the 1800s. We are not supposed to be functioning in that institution anymore, but we have no choice. It is what we have. I have a plumbing issue. I'm not sure I have a plumber who actually knows how to work on that plumbing. I've not identified one. And the list goes on. But in the next 5 years, this is what I can tell you today. In the next 10 years, there's about $400 million of infrastructure investment for us to continue to function in that space. It is a better investment to be proactive, to pass Senate Bill 476 and start working toward understanding what a replacement facility would cost. And we do have land behind the New Hampshire Correctional Facility for Women that we're exploring. And having done the work at the New Hampshire Correctional Facility for Women, I know it's hard rock, but I know we actually saved $500,000 making our own crushing plant, and it's a firm foundation and we can move forward. So with that, I do have members who have worked several years at the New Hampshire State Prison for Men from my security force and who are leading that force that are happy to talk about operations if that is an inquiry that comes up from the committee, in addition to my logistics and finance staff. So with that, I certainly entertain questions.
Thank you, Commissioner. Questions from the committee? Representative Weiler.
I'm delighted that you found a good location. I remember what we went through with the women's prison, and that was a lot of waste of time and effort. And I'm wondering, with the Berlin prison, are we going to have any savings because we've had a design done and we've paid money for it? And if it works, can we reproduce that or parts of it without paying for a whole new design?
Representative Weiler, I really respect your question. I'm actually working with partners outside of the state. For example, the Commissioner of Montana is building a similar sized institution. And if there's some opportunities to understand in 2024 what we can learn from, this investment in Senate Bill 476 will help us get there. Reminding everyone it was built in 2000 and we've learned a lot more. But again, there are opportunities in every turn we make, but we would need to invest in this first.
Thank you.
Thank you, sir.
Other questions? Representative Ebel.
Thanks for coming. Having visited the facility, several years ago, it was also, it was daunting to see how much work needed to be done at that time. How long would the engineering that we would be considering funding take? And how long would it be good for? Because budgeting for $500 million is a lot.
Thank you, Representative. It's a good question. We already have a pending proposed contract for the $10 million that we're waiting to bring before Governor and Council. The timing of this, yes, would afford us an opportunity to move that more fluidly. We would expect it would take at least a year of this resource to start moving toward a final proposal, but I would suspect no longer than 2 years, understanding the timeline and the experience that the agency already has in building the New Hampshire Correctional Facility for Women.
Okay. So you said you identified a prison in, was it Minnesota, that is similar. How many inmates will this prison have?
The facility that's being built is in the state of Montana. It's
sorry.
approximately being built for 1,400 people. We have about 1,100 people at the New Hampshire State Prison for Men. The investment contemplated in Senate Bill 476 includes forecasting population both on past experience and also what the legislature might pass towards sentencing that would affect population rates, including the classification of those individuals. In talking with the commissioner of Montana, that institution doesn't have all 5 levels of classification. It has 3. So we are engaged in confidential conversations at this point because it's about his design of the interior of the facility. But there are some definite opportunities to partner with people already doing this across the country.
Because this 40 million is strictly for creating documents. And so I'm getting sticker shock on that number, and it seems like repurposing some existing design. I mean, there's prisons all over the country besides the one you just mentioned. It's got to be much cheaper than that. So would it make sense, even if we allocate this 40 million? To not be so specific that we only spend this on documents and not on actual construction?
Representative McGuire, that's a reasonable question. If there's an opportunity to, again, and we will work toward that, reduce this expenditure to the only point necessary and have any of those funds then go toward the construction, then we would completely be in favor of that.
Representative Evil.
How many contractors in the United States actually build prisons, and are their services in demand?
There are at least 4 that I know are commonly contracted with. Again, the carefulness and me not talking too deeply about what's going on in Montana is we have a competitive bidding process, and we would have to, as a state, go through that competitive bidding process. But I, as the Commissioner of Department of Corrections, am mindful that I have opportunities to talk to people who are already engaged in this. People are not building prisons every day. This just happened to be a unique opportunity to talk about what's happening in that state. I'm obviously keenly aware and watching what's happening in Alabama. They look like we looked in 1976, and I expect to see a lot of different things happen in that state, and they're not meeting their, allegedly, according to the media, healthcare and other needs. So again, I understand who's out there, but we have to follow a competitive bidding process in our state.
All right. Yes, Representative Griffin.
Thank you, Mr. Chair. Thank you. I too am in sticker shock that it costs $40 million just basically for plans. And it really concerns me that it can't be done for less. It's hard to believe. Buildings are, I know a prison is a different building, but buildings are built all the time, complex buildings, and $40 million would be a lot of building. So I don't know if they have any comment to that or not.
Representative Griffin, I completely appreciate your comment. I grew up in a construction family. We pour concrete. That was what my parents did to feed us on a farm and construction. And this is a high number, but the cost of a correctional facility at this point, really working with our partners at the Department of Public Works, they're estimating as high as $1,000 per square foot. We don't control the construction market when it comes to corrections, but I am completely mindful of the work that I did on behalf of the state in getting the New Hampshire Correctional Facility Women's Project at a lower number. I know we had to come back and ask for more, but when I started intervening in that project, they wanted even more. So designing for efficiency and responsibility is our charge on behalf of what you provide us the opportunity to do so. We're not building a 2x4 construction. I know you appreciate that comment. It is cement. It is all of those things that unfortunately cost more, in addition to working on a correctional facility and having that expertise. It's a high number, and is just the number based on the current market.
All right, so you said $1,000 a square foot. So it's 500 square feet per inmate? Is that right?
Representative McGuire, I couldn't just do, here's your square feet for the total allocation, because there are core infrastructure areas such as our dining, kitchen service, our health services area. Those areas have different square foot requirements based on the operation. It's not a 1-for-1 square foot for what we have now and what we would be looking at in the future.
Do you know how many square feet this current state prison is?
Ms. Laramie, do I would not be recommending we replicate the current square footage of the New Hampshire State Prison for Men, given it's a campus style layout. So again, I'm not sure it's a number that will help us in looking at the future. Other than affirming for you, we've worked with the Department of Public Works.
I mean, the numbers we're talking about here is $500,000 per inmate to build this prison. What's the ongoing cost? What does your whole department spend per inmate for operations?
For operations, my last estimate was around $52,000 per person. Can you talk louder? 72,000.
Wow. Okay. And so probably if we borrow 500,000, this says we're going to be paying back over 20 years 750,000. So we're going to pay roughly another 37. So an inmate's going to cost us $100,000 a year, including the building. That's pretty incredible. All right. Because I had always thought, you said 72,000, but I always thought it was much less than that, more like 40, no?
I believe the salary adjustments that occurred have caused that number to increase. So yes, the cost of staff causes that operational cost to go up.
I see. How is hiring going lately?
Hiring is much better than it was post the pandemic. We are holding our own, but we are making up for those major losses in 2022. But I appreciate you asking. And as an aside, it's Corrections Officer and Employee Appreciation Week. So if you see somebody in corrections, please thank them for their service. This is our week nationally.
Yes, Representative Griffin.
Thank you, Mr. Chair. I know the women's prison it was a design that was costly in terms of staff. Would you agree with that?
Representative Griffin, I think it would be fair to say any transition from Goffstown to a larger facility was going to increase staff. But we've operated in it now with less staff than we thought we were going to need in the beginning.
I know when it was originally built, everyone looked at the design and said, you know, that's going to be very staff intensive. Is the model, the Montana model, are there actual plans at this point for that prison?
My understanding, the answer to that is yes. I've not been able to look at them. I am anxious to see if I can have an opportunity to look
So
at them.
you wouldn't have an opinion of whether it's efficient in terms of staff or not?
No, but Representative Griffin, what I would say to you, any design in the future would be cognizant of creating staffing efficiency. And I think a very appropriate leaning heavily on technology as a resource and really investing in our current infrastructure. We're trying to do some of that that would be transferable to any new replacement facility as far as implementing technology.
Thank you.
Thank you. All right, Representative Cambrils.
No, thank you, Mr. Chair. Do you recall what the cost was for the design of the women's prison?
So that was roughly 10% of approximately $52 million back when that project started in the 2000 and I'm not going to guess on that one, but it was about 10% of $52 million. Mm-hmm.
Is there no follow-up? Okay. Am I right that the operational cost of Berlin per inmate is much less than Concord?
I don't have a breakout of operational costs by facility.
So I visited both, and my understanding is one is, like a long corridor and then different units kind of off that corridor, and essentially one officer can almost control the whole thing by, being at the end of that long corridor and watching and letting people into it, closing the doors, letting them out, etc. Whereas in Concord, it's this building, that building, the other building, and you need an officer in each or multiple officers in each. Am I right? Or...
So Representative McGuire, the Northern Correctional Facility was designed to be a direct supervision model. So when it opened, there was one officer in each housing unit, so each unit off that long corridor. And then in 2009, 2010, I believe we know what happened in our economy and the department, in order to reduce the impact of layoffs on staff, created what's called a roving patrol. And that roving patrol and that physical plant has allowed for groups of officers to go to each housing unit to monitor the conduct on those units. But to the point of your question, there are lots of efficiencies that can be gained in replacing the New Hampshire State Prison for Men and utilizing a new design, improved design, other than what we currently function under right now on the campus.
I wish you would try to quantify this question about Berlin versus Concord.
We can certainly look into that, sir.
Yeah. Because if you can say I can reduce 72,000 to 50 or something, that helps us pay for this. Now, let's say we have a design and we borrow the money to build the prison. What's the construction time involved?
I think it would be premature me to pitch what the construction time would be until we put out a bid and received a response back. I can only tell you what it took us to build a New Hampshire Correctional Facility for Women, but Representative Weiler at the onset pointed out some challenges in that project that I don't suspect we will have again, given that they looked at 11 something different designs and I think 4 or 5 different locations. Is that correct, sir? That's not what we're trying to do in this program proposal.
Thank you. All right, shall we, let's move on to, would our treasurer like to say anything here? How much can we borrow?
Good afternoon, Mr. Chairman and members of the committee. For the record, State Treasurer Monica Mazzapelli. How much can we borrow? Well, it's all depend of how much, if your budget allows for debt service, right? So one of the things is when we talk about the capital budget, we typically talk about, we give a typical recommendation. Our estimates usually use about 120 million for the biennium, and that's a common number, right? That I think everybody knows. In terms of so when there are appropriations, capital appropriations in the middle of the budget year and an off year, that usually, obviously, and for the last capital budget, it was 137 million was authorized, which included additional payments for the university system. So that was all included. So you authorized a little more that we typically recommend, but that's fine. It's the state can certainly absorb that. So this 40 million will certainly add to that number, right? So I just want to be mindful of that number. In terms of the state having the capacity, the state has the capacity to borrow another 40 million. We did not consider that debt service as part of operating budget, but again, we calculated the numbers and that's how much it will cost to add that to our debt service. Right now, we're in a position where the state can certainly borrow a little more. Again, our calculations are based on that number of 120 million. We'll continue to in general estimate and project that the number to target that number, and it's all based on your debt in relation to your revenues, right? So right now your revenues are very strong. If that picture changes over time, we need to consider that 120 million. I know I've heard folks going over that number, which is all it makes sense since construction costs have increased and that makes sense. But again, your borrowing should be in relation to your revenue. So again, right now, the state has a capacity. I wouldn't have a concern with this number right now. In addition to that, I've had conversations with Commissioner Hanks about this particular project. The cost of this project obviously is pretty high, a lot more than we typically borrow during the biennium. And one of the discussions, we're gonna, once the commissioner has more numbers and an understanding of the cost and time and all of that for this project, I will take that information to try to see if there's anything else. If we could consider this project separate from our typical capital budget, because perhaps this needs to be considered a separate project, look at it in a different way. The useful life of the prison is going to be a lot more than 20 years. So when we borrow funds, we have this requirement of 20 years, but perhaps for a project like this one, we could consider 30 years, perhaps. And it will be okay, again, because of the useful life of this asset. So those are the conversations we can have. We can probably, again, once we understand better the cost and timing, I can bring that back and speak with some experts that I work with to see if there are any great ideas out there that we could consider.
So my back of the envelope calculation is if we were to borrow the entire cost of the new prison, it would add about 50% to our debt service payments annually. Is
The
that
entire
right?
cost of the
550 million or whatever. the
Yeah,
number is.
and right. So we typically borrow about 60 million each year.
Okay.
So an amount like that. Obviously, the construction is going to happen over time, so that's also part of what we want to understand. Perhaps it will be 100 million in addition to what we already borrow. So it's a significant number. This is why we probably want to have a good handle on the cost, timing, and then see how those numbers look like. But you're right. I think that will be an expensive project, of course.
Right, but I'm just going off of, you said we're paying 120 million. Is that a biennium?
That's the biennium, right? So we
for
budget
debt payments.
Correct.
So this would double our.
I'm sorry.
Essentially.
So the 120 million is the amount of borrowing. The debt service, we are in the neighborhood of 72 million per year, per fiscal year, in terms of all of the debt service that we have.
Okay,
If that makes sense.
So that doesn't match what I see in the fiscal note. So in the fiscal note, so you said we're borrowing 120 and paying over 2 years, yeah, 60 a year, right?
So
I guess it depends on how much debt we have.
yeah. So I guess I'm not probably come with my comment.
All right,
but
this
there was
is
some
borrowing
confusion,
40 and paying 4.6 per year.
in addition to what we already pay in that
In
service.
addition to what we
Yes.
already pay.
Yes.
Right. I see, but the ongoing stuff is.
Right, so the current debt service is about, right now it's about 17 million, or I have my numbers here, but I can get you that number. But, right, so this would be in addition, this 4.6 million would be in addition to what we will
So
currently,
current debt service, 70
Budget.
million a year, a biennium,
approximately, no, a year.
a year, okay. All right. So, so if I take this number and multiply it by 12 or 13, right, for the whole prison,
I don't really have all of the,
yeah, we're talking about, yeah, so this is almost going to be doubling our debt service payments.
that's correct.
Yeah,
This is why, a potential solution could be to not use the typical 20 years, so
use
just
30 years. yeah.
defer a little bit. Obviously, it's going to cost more money, but again, it wouldn't be unreasonable considering the useful life of this asset.
Gotcha. And we have debt service on the women's prison, yes?
Yes, I don't have that number with me. Yeah, so current debt service is about 60 million. It is 73 million actually, because we also pay for the university system. So it is 73 million in debt service that we pay each fiscal year.
Thank you. All right. Other questions? Yes, Representative Wyman.
Congratulations on the increase in our credit rating. Has
Thank
that
you,
helped us
Representative.
lower the interest?
Yes, I mean, in general, it does help us. But thank you. And more than anything, I want to thank you all, because this is the product of your work and your good decisions. You're the ones that make the hard decisions, not me. I was just the messenger this time. So, but thank you very much. So yes. So in concept, yes. So just to give you an example, the state of New Hampshire issues bonds only once a year. So we're not, we don't have too many bonds out in the market. So our paper is pretty attractive. Just this last time that we went, we had the sale. We had 15 bidders. So that it was a very good result for our sale. And overall, yes, we did have a good rate. So we achieved 3.4% for our last sale. So yes, so in general, it just obviously if our investors will want to buy our bonds if we continue with the good management of our finances. But again, this is thanks to all of you.
And thank you.
Thank you.
Shall we talk about this bill? Do we want to spend 40 million now? Do we want to increase the scope of the bill? Do we want to borrow this money or spend money we already have? What do you think? Yes, Representative Evil.
Well, I mean, I was on Public Works when the issue came up with the women's prison, and we hemmed and we hawed and we hemmed and we hawed, and then all of a sudden we lost, there had been all these lawsuits, right? And then the court basically lost its patience, and it said, the time is now, either you do it or we're going to go ahead and start the construction for you. And it was a mad scramble, as Commissioner Hanks was saying, trying to figure out where to put it, how to build it, to get the plans. I don't think there's anybody sitting here that doesn't have sticker shock from $40 million. I like the thought that maybe you can reduce it. I'm encouraged that the treasurer feels that we can accommodate it off cycle. I guess I just feel like we're over a barrel here, and we can't really put off some sort of commitment to the people that work there, to the prisoners that are there, to avoid litigation. I just feel we have to do something to start moving forward. So I would be in support of the bill for all those reasons while quaking from sticker shock.
Other thoughts? Yes, Representative Griffin. See some nods here, yeah. Okay, Representative Sweeney.
Yeah, it's feels like one of those things where we have to do it. Otherwise, the cost to just keep up the existing facility over the next 10 years will dwarf what the financing to get the project started. I do not, I mean, so we just passed a new police station in Salem for $38 million that 10 years ago would have been $20 million, but due to inflation and construction cost increase, it's just all over there. I hope we can get a better interest rate with our credit rating. But it feels like we're in that rock and that hard place.
Okay, so Mr. Hoffman, if this bill passes, presumably before any of this money is spent, the executive council looks at the contracts and choices of who, and if they find that the engineering and design can be done for less than 40 million, then the rest of the 40 million will either have not actually been borrowed or will be available for construction or other purposes, correct?
Construction, which could use the existing balance.
I see. So is that the way it works? Is that once the contract is let, you then go out and borrow the money?
That's correct. So we borrow based on expenses. So once the agency starts spending money, that's when we start bonding in pieces, because again, it's gonna go over time.
Thank
It's
you.
gonna happen over time.
All right. Would anyone like to make a motion? Yes, Representative Ewan.
Well,
Mhm.
I would make the motion, even though that means I have to write a committee report. But under the circumstances, I think that we really should do this, and well, do I have a second? Okay, thanks. The only other thing I would add here is just, again, from my experience on Public Works and working with the treasurer, she gives us very wise and very conservative recommendations, and I guess I have to say that if the treasurer is telling us that the state has the capacity to bond for this, I respect your opinion and your conservative analysis, so I feel like we can take, solace in that and feel comfortable with the bonding amount. So, and I mean, we've discussed this at length. There's no question that we need to move ahead. I guess not to belabor the point, but I also remember in Public Works, one of the first moves we always made is to try to get our engineering house in order to lay the groundwork for the next big step.
Any further comments on this motion? All right, the clerk will call the roll.
Yes.
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 Representative Grassi.
Yes.
So you may want to stay for the next bill. We're hoping to send you some more inmates,
So I don't we're trying to reduce terms of incarceration, but don't increase incarceration.
Well, there's some nasty people here that. All right. All right. So we have plenty. We are on time slightly. We're a little late. So let's start with Senate Bill 591. Who is here to speak to that? All right. Yes. Okay. So I see our Attorney General.
Yeah. Good afternoon, Mr. Chair, members of the division. I don't mean to interfere
Do you
with
need his
Senator.
name or we will? Yeah. There you go. Okay. Good.
I certainly don't mean to preempt Senator Bradley. At the other hearings we've had on this bill, he's introduced the bill, but I'm assuming, based on who's here, that I should probably just speak to it. How would you like me to proceed? Would you like me to give an overview of what this bill does? I know this is scheduled as a work session, so just to be clear, I want to make sure I'm giving you what you need.
We're only concerned with the money.
Okay.
So the $60 million.
The $60 million piece.
Yeah.
Okay. So at present, I guess I'll start with just giving a current status of the settlement fund process. We have received, I think, about 450 claims, but 163 claims have been resolved or settled for a total of about $82 million of the fund. The fund has $2 or $3 million in administrative expenses that have been expended since late 2022. So there's roughly $15 million left in the fund. So the $60 million is intended to replenish the fund. But it also goes along, I think for this bill in particular, to understand the $60 million, it's important to understand some of the major changes that are being made to the settlement fund process. So without going over all of the background on how this came to be, because I think at this point the legislature is fairly familiar with it, but I'm happy to take questions. As you know, when the YDC settlement fund process was first set up, and when the first bill passed back in 2022, we did not have broad consensus on the bill. I think from the Attorney General's office perspective, we felt that the bill set up a victim-centered and trauma-informed process that would be appropriate for many of the victims at YDC, but we hadn't achieved broad consensus. The bill that's before you makes some changes to that process that now come with agreement from Nixon Peabody and Russ Riley, who represent 90+% of the claimants. There were three main reasons why Nixon Peabody and Russ Riley had not agreed to recommend this process to the vast majority of their clients before. One of them was just the scope of the bill, the scope of the claims process, what types of harms and abuses the claims process covered. Another major point were the caps. So what the caps were at, they thought the caps were too low. And then a third major point was just the process and how it worked. They felt the process was too complicated. And while we felt that it was a fairly streamlined process, certainly compared to the traditional litigation process, they felt the process was still too complicated. So this bill makes a number of changes to address those concerns. The first thing the bill does is it raises the caps for egregious sexual abuse from 1.5 million to 2.5 million. We expect that egregious cases will be a fairly, certainly the distinct minority of cases that come through the fund. Perhaps the best way to illustrate that is that right now, the number of claims that have been resolved at the cap, it's about 10 or 11 out of 163. So it's a fairly small percentage of claims that I think would be subject to that increased overall cap. The bill also expands the scope of the fund to expand the definition of sexual abuse and include other things. It also creates a second category of abuse that's no longer just physical abuse. It's physical abuse plus other things. So that will now be a category of other abuse. And in exchange for that, in exchange for expanding the scope and increasing the caps in certain places, the bill provides that the administrator will now be empowered to award claims in annual installments. So right now, claims can only be awarded in lump sums, but going forward, if this bill passes, the administrator will be empowered to award claims in annual installments, and the bill will also impose a $75 million per fiscal year cap on the amount of money that can be paid out of the fund. So that sort of in exchange for raising the caps and expanding the scope to get more people to come in, we have those safeguards that at least protects the state from having this become a runaway process in which hundreds of millions of dollars get expended at any one fiscal year. There will still be an option for the administrator to come to the fiscal committee and to the governor and council to raise that limit in any given fiscal year, but there will be those safeguards in place so that if the bill, won't cause the state to spend a lot more money than it has. And I would expect that whether the fiscal committee or the governor and council would agree to increase that limit in any given fiscal year, that will depend on how the state's finances look at that point in time. So those are the basics. And Mr. Chair, just because you said you were only really concerned with the money, I wanted to hit those points. I'm happy to answer other questions, but the $60 million, that was our estimate provided to the Senate at the amount of money that we thought would hopefully get us through fiscal year 25. So between now and the end of fiscal year 25, given that going forward, if this bill passes, payments could be awarded in annual installments. As I said, there's about 15 million left in the fund now. If we add 60 million, that would get it up to 75 million. And I expect that will be close to the amount we need to get through the end of fiscal year 25, given that if this bill passes, we're going to have to go back through the fiscal committee to change the guidelines. And we expect that the claims process will either slow down significantly or even be put on pause for a time while we rewrite the guidelines to match the revisions in the bill. So all that said, that's where the number 60 million comes from. And I'm happy to answer any questions on other details of the bill or anything else about this process.
Thank you. So did I hear you say that it's about $500,000 settlement per case on average?
Yes, that's correct.
Okay. And how many cases are there altogether?
There have been 450 claims filed so far. We know that Nixon Peabody and Russ Riley represent 1,300, 1,400 people. Now, they've already filed some of those claims in the fund. But altogether, I would say we're probably looking at close to 1,500 claims, maybe more, that could come through the process. It could be less because the plaintiffs' attorneys have committed that with these changes, they'd recommend the process to the vast majority of their clients. But we're certainly looking at a number between 1,000 and 2,000. And I think it's at the end of the day, when this is all said and done, I would estimate we're going to be somewhere in the 1,500 claims range. But it's difficult. We will not know until the deadline closes next June of 2025.
1,500 claims. So we're talking about $750 million. Is it? And yet there's only a dozen criminals involved in this?
So,
I mean, is it really possible for them to have? Yeah.
Well, so 11 individuals have been criminally charged. I think what you have to remember is that these types of cases are very difficult criminal cases to bring, even when the alleged abuse happened last week, let alone decades ago. There are also many allegations that stem from a time when the statute of limitations to bring any criminal charges has long passed. So I think it is, that's what makes what happened here, or it's one of the things that makes what happened here so difficult to grapple with. We're talking about a large span of time. I mean, we have allegations from the 60s, so 60s, 70s, 80s, 90s, early 2000s. And once you get back past the 1990s, any statute of limitations for criminal cases would have long passed. So I don't think it's as much as it may be tempting. Unfortunately, I don't think you can really use the number of viable criminal cases to make a reasonable estimate as to the number of viable and credible allegations of abuse that occurred there over the many decades that we're talking about.
Why was there such a delay between the crimes and now, and coming to light recently?
Well, that's a question I will never completely be able to answer, but I think that that has a lot to do with the fact that until the first couple of victims came forward, the others didn't have the courage to come forward. So I think that's part of the reason that explains the delay. But beyond that, that's something that's difficult to answer. I mean, it's not uncommon for victims of sexual abuse, especially to take many years to come to terms with what happened to them and to have the courage to come forward. And for kids who might have been in custody in a juvenile detention center, this is a population that's particularly susceptible to think that no one would ever believe them.
Representative Camrose.
Thank you, Mr. Chair. Thank you for taking the question. To date, have any of the claims been rejected as unfounded? So they got paid nothing?
There have been claims that have not been paid anything. There have also been many claims whose awards have been much less than the amount they claimed. So it brings up an important point. This is not a process in which you just come through, you say this happened, and you get paid out for what you claim. Right now, for even the claims that have been resolved, the amounts that have been paid out are close to half of what was actually claimed. And as more claims come in, we'll get a sense of what the true average will be. I don't think it's guaranteed to say the average will maintain at 500,000. I mean, even though we know that 1,000 plus lawsuits have been filed, it's not until we see the actual details of a claim in writing that it can really be evaluated. But that was a long answer to your question. But yes, some claims have been paid nothing, and many, many, many claims have been paid significantly less than the original amount claimed.
Thank you. The reason I asked is I just wanted to make sure it's not a situation where anybody that comes forward that had been there makes a claim, and then for convenience sake, we pay them out just to make them go away. That's not the case, right?
No, that is not the case.
Okay, thank you.
Representative Lane.
Thank you for taking my question. What would the impact of the recent case that awarded $38 million have on this whole thing? Because I know as a plaintiff's attorney, I would be hesitant to recommend to settle for this amount with that out there.
Yep.
And I know it's not a final one, but just how does that impact all of this?
Yeah. So I would answer that in a couple ways. One, I think it's safe to say that the case that was just tried was one of the most egregious, if not egregious, cases that we would see from YDC. Second, and I don't, we've still got, and I know you'll understand this, we've still got, pending litigation arguments in front of Judge Shulman, and I'm sure you've seen the news about our position on the cap applying, but the case is a good example of the risks of litigation either way, right? The jury came back with a high damages number, but they also came back with a finding of one incident. And, we feel very strongly that their finding of one incident should and will hold, and that the actual judgment in the case will be $475,000. Beyond that, I'm not going to say more, because I don't want to be seen to be arguing our case here in this forum. But to answer your question, I think we don't know for sure what impact that will have on how many claimants come through, but I do think that case was a really difficult case. I mean, it's an understatement to say that it was the most difficult for Mr. Meehan, and can't imagine what he went through. That case was an example of how difficult it could be to try any one of these cases, and the risks involved for either the plaintiff or the defense in going to trial in one of these cases. Yeah.
Is there a legal case being made against us that we should not be able to set caps? Because it sort of seems to some extent self-serving for us as the defendant, thank you, to say, to make a law that here's all we can pay, right? You know what I mean? Not that I think the taxpayer is in any way responsible in some sense. I don't know. Thank you. So is that is somebody making that case against us that we cannot make a cap?
That case may very well be made at some point. You know, in my role as the Attorney General, I certainly would not agree with that legal position if someone took it. I believe it's ultimately up to the legislature to determine to what extent, you know, the state is going to waive sovereign immunity. But to answer your question, that case has not been explicitly made up to this point, but it could be made as we move forward in the litigation piece of this.
Have there been similar cases in other states or nationally that bear on this, on the way this settlement is going forward?
Do you mean the way, you know, with regard to litigation over caps, or just handling something like this
over
generally?
caps on cases like this, on the case of abuse of children?
Off the top of my head, I would say I'm not well versed enough in litigation regarding caps that states have placed on you know, the liability of a state. But I do think there is pretty strong case law that supports the concept of sovereign immunity. And at the end of the day, what a cap is the state waiving sovereign immunity up to a point. Because the state actually, I think, the state would have the right to not waive sovereign immunity at all. So to not allow any recovery against the state. But the state has not done that.
All right, thank you. Any other questions? Representative Waller.
Just a really quick one. So I know that in this bill, we're changing that now we can pay annually. Is that the claimant can make that choice, or is that the way all payments will be made?
All payments will not necessarily be made in annual installments, but it will now be up to the administrator. And whereas before it was completely the claimant's choice, the administrator can now require it as part of the administrator's job to sort of manage the fund and ensure that no more than 75 million goes out in any one year. Yep.
How could a jury even come up with a figure like $38 million? It makes no sense. It doesn't help the person. They're just going to waste the money. The lawyers are going to come in for a big piece of it and think, whoopee, we'll get more cases like this. I mean, was the jury instructed as to what money would be used, or how would it be used, or how you even can claim? Obviously, the average person, if they were working hard and keeping their nose clean, might make over $1 million in a lifetime. Somebody got up to claim, oh, he'd lost $2 million in his lifetime because of his earnings. An exceptional person will make a couple of $1 million in a lifetime, but not if they've been in trouble and hadn't gotten any advanced qualifications and work hard to get enough that. But some of these figures just boggle the mind, and I wonder why your team didn't even bring the reality to this jury. It's crazy what they came up with.
Well, I'm going to be careful on commenting on where the jury landed, but I will say, you know, on behalf of our team, I mean, I couldn't be prouder of the work our trial team did in this case. And as you imagine, it was a very difficult case for attorneys from the Department of Justice to have to try. It's not many times at the DOJ, you know, our team is wearing the white hat. We're either prosecuting offenders or we're playing offense to protect the public, and having to defend the state in a case like this it's a complicated endeavor. It's a difficult endeavor. I think the trial team did a great job, and the trial team certainly made a strong case. And I bet you if plaintiff's counsel were here, they would tell you that. As far as where the jury landed, you know, that could be the subject, certainly the subject of post-trial proceedings and appellate proceedings. And even aside from that, I want to be careful with commenting on how the jury came up with what they came up with.
Interestingly, we had never heard the 475,000 cap until we read it on this case.
Well, with respect to that, Representative, I would say that I certainly have discussed that cap when I've been before the legislature and when I've talked about this settlement process, and it's in the statute. And that was an issue that certainly was discussed in depth and in detail in front of the judge in this case. And the judge decided that the jury would not be instructed on the cap. But I think that I've definitely discussed the cap when I've been before the legislature. Yep.
Other questions? Seeing none. Thank you very much, General Formella.
Thank you.
Are there others who would like to speak to us about House Senate Bill 591? Yes? No? No? Yes? Yes, Madam Treasurer. Yeah.
Thank you, Mr. Chairman. Again, for the record, State Treasurer Monica Mazzapelli. I do not have any comments as to the purpose of this bill. I understand why it's being this amendment drafted. The only comment I have is relative to the bond and authorization. My only, which it could be understandable that perhaps there will be the opportunity to finance some of this cost as some of the right now we have it sounds through this bill there's a particular estimate as to how much perhaps the ministerial can spend. So there are only two ways to fund this, through appropriations or through the issuance of bonds. So the only comment I have is for you to consider is typically we see in bills a bond and authorization amount. The reason an authorization amount is helpful is because I have to budget for debt service. So this will be debt service that will be paid with general funds. The other purpose, the other reason why it's important to have an authorization amount is because I have to calculate the debt limit every year. There's a requirement, RSA 6C, that I have to calculate a debt limit so you know how much you're able to borrow each year. So because of that, I think it will be important to have a better understanding as to that borrowing amount that you may consider, whether in the aggregate or annually. So the bill is silent on that, and that will be my only comment for you to consider. And if it's not through this particular bill, we will probably have to have the same conversation when we're trying to budget for the next biennium, just because we will have to have a better picture as to how much we're going to be able to borrow. If you're considering borrowing, again, I don't know how the legislature will try to fund some of how to replenish this fund going forward. There are some unknowns. I understand that part too. But again, just something for you to consider as you're discussing this bill. Typically, we see a bond and authorization amount for every capital appropriation. This one is not a capital appropriation. It will be borrowing to try to fund or replenish this fund. Another piece I just want to mention for your knowledge, and again, this perhaps could be discussed in the future, but any borrowing related to, for this purpose, as the bill is written, it will have to be a taxable debt, just because this is not to benefit the state directly. This would be to benefit the members that will benefit from this fund, the beneficiaries of this fund. So for that, typically the debt is a little more expensive than tax and sub debt. So something for you to consider as you're funding this for this purpose. Yes, thank you.
So I think this is an appropriate time to bring forward my amendment. Because I agree with you that this is maybe not an appropriate thing to borrow money for.
And it could be part of the planning, right? So I think part of what I also wanted to mention is it could be appropriate to borrow for this purpose, and perhaps you can design a plan that could have a combination of appropriations and finance and financing a portion of it. So that could be perhaps an appropriate plan to proceed. I think what will be important, typically it is helpful to know and try to estimate how much you want to borrow. We typically, as I mentioned previously, as when I was speaking before you, is we developed the debt affordability study. We tried to project how much we're going to borrow and how much the general fund is going to pay. And so this will be part of those calculations that we prepare. But again, this is all if you wanted to do some borrowing related to this bill.
So, thank you. So I agree. So I think that there's a big difference between this bill and the previous one, and that is, I think it's appropriate to borrow for capital equipment and goods and things like roads and prisons and stuff that's going to be used over long periods of time, houses, right? But it's not appropriate to borrow money for expenses. And I see this as a little bit more like an expense, right? There's going to be a certain amount that we have to spend, but it's not something. It's something really that's the obligation of, in some sense, past taxpayers or current ones, and not future ones. And so therefore, it's not really appropriate to borrow. So the question is, where do we have $60 million? And as you all know, we have it in the Education Trust Fund. And so that's what this amendment does. I guessed you might. That's a shock, yeah. All right, any comments? No? All right. All right, so I'm going to move ought to pass with amendment, I guess. And
Don't we vote on the amendment first?
yeah, but I'm moving that, and so I'll move my amendment. All right, any comments on the amendment? Representative Grassi.
If this goes to the floor of the House and your amendment is rejected, where does it leave us standing?
Well, then it would simply be, if
Bill.
it was ought to, if the committee was, assuming the committee was ought to pass with amendment, then, and the amendment's rejected, then there's ought to pass. I obviously, there could be floor amendments,
The
right?
basic bill that we have here would be next up, so.
Yeah. Representative Griffin.
I think there is some logic in charging the Education Trust Fund, because most of these victims were school-age children for the most part. They were teenagers, high schoolers. And, yeah, I would support it.
I know I'm only a substitute, but
You get to vote.
I get to vote, and my feeling is that until we get through, having sat as a substitute for long-term on education, until we get the lawsuits about adequate funding for schools in the state, and until we adequately fund them, I don't think we should be robbing Peter to pay Paul. And I don't understand the analysis of taking money that we've put aside for education and using it to pay for what is amounting to negligence on the state's part in its administration of the youth detention center. Thank you.
So Representative Lane brings up an interesting question. I don't know if General Formella would like to say anything about the education lawsuits and what status they. Okay, thank you.
So I guess my answer on that might be somewhat disappointing. I mean, I think it's best not to really get into the substance of the education funding lawsuits, other than to say I could understand the position that you might not want to mess with the education trust fund while that's pending. But didn't come prepared today to think that through very deeply. I would just point out when it comes to taking money from the Education Trust Fund, the other thing to keep in mind is that, if some of that money came from the lottery funds cannot be diverted away from the Education Trust Fund. So you would just want to make sure that if you're diverting $60 million away, that you're not taking lottery money. And I wouldn't be in a position to do that analysis right here, sitting here, but that'd just be another point I'd make. Given that the bonding authority was discussed too, I thought I'd just make a point with that. The way the bill's drafted, it's not saying that the state will borrow anything. It just contemplates that the legislature and the governor and council in a given year might decide to borrow money to replenish the settlement fund, as opposed to just taking money from funds not otherwise appropriated. But other than that, I'm not sure it's my place to comment on this amendment, because it seems that it's just the legislature making a policy decision on where to pull funds from. And as long as you keep in mind the constitutional restrictions on how to use lottery money, I think that's a decision that really is up to you.
Thank you. My argument back on that specific point would be the amount we send to schools is way, way greater than the total amount of lottery money. And so therefore, what we're spending here would be what other funds that are not lottery funds. I mean, presumably we could put some kind of line in here, but the money is fungible, right? So there's no, there's no color on $1 versus another that says this came from the lottery and this came from, you know what I mean? So, yeah.
Yes, money is absolutely fungible. And I think that would probably be a question for the LBA, if anyone, to take a look at. I went to law school because I'm not good with numbers.
Further discussion. Representative Ebel.
Without commenting specifically on this, what does it take to get into the rainy day fund? And is this a rainy day? Does anyone know?
Mr. Hoffman?
Do you know?
I'm sorry, you were asking.
Well, there's also a rainy day fund money, and I was curious how one accesses, dives into the rain. Huh? Well.
All right. Madam Treasurer, do you want to come? Yeah. Thank you.
Thank you for the question. So that just as a reminder that the rainy day fund is a reserve, and by law, it can only be accessed if there is a deficit at the end of the biennium. So normally you will, it's not a typical process. There is a procedure, yes, that I forget is a number that needs to be passed in order to withdraw funds from the rainy day fund before the end of the biennium. But the typical process is just in the event of a deficit, or if the state doesn't collect enough revenue, that's when mechanically you could potentially access funds for the rainy day fund. But it's not so it's a sensitive topic when it comes to discussing to investors and the rating agencies, because one of the reasons we received the rating, the upgrade, because we have strong reserves right now. So strong cash reserves was an important part of the upgrade that we received. So just hopefully that answers the question.
Representative Wallner.
Yes, thank you. When we originally set up the settlement fund, wasn't the first $100 million that we deposited into that fund, wasn't that from the rainy day fund?
It was an action of law in which it was completely understood why that was taken at the time. It was a policy decision. One of the concerns I raised at that time was, perhaps I was trying to suggest if maybe it could have been taken from some other place, just because I know how sensitive the fact that is sensitive topic. Again, I have to respond to questions from investors, from rating agencies. Why are we taking the money from that pot if we have other pots of money, right? So for the most part, my recommendation is, you have your reserves. we all have emergency funds, so should have emergency funds. So that's what the rainy fund should function as an emergency fund.
Representative Wallner. Sorry, Weiler.
My recollection on the rainy day fund, there's two times you can take the money out. Either the revenue comes up less than we assumed when we made the budget, or the spending was more than the budget called for. Those are the two times you get in the rainy day funds.
That is correct.
So my understanding is that if revenue is low or lower than expected in a budget, the governor is authorized to and obligated to spend less by canceling whatever he can to make us not run out of money. Is that right?
That is also an option, of course, controlling expenditures before the end of the biennium. Yes, and we did that. It was done during the pandemic time. It was a difficult time. There were some limitations on the amount of spending, and also there was the plan to tap into the rainy day fund at that point, but just the economy changed, and we received funds from the federal government. And at that point, things just turned around, and we started recovering.
Representative Ebel and then Representative Lane.
I just wondered what was currently in the rainy day fund. Do you know?
I believe it's $292 million.
Thank you. What are there other reserves that you mentioned? Other reserves when you were talking. Would there be other reserves that we could take this money from?
No, thank you for the question. No, so the rainy fund is really the one reserve we have. I mean, I was speaking about strong reserves because we have a strong cash position. We still have ARPA funds, but in reality, everything has been appropriated through the budget process. Probably the only items that have not been appropriated are the surplus revenue or the additional revenue we have received this year, which is those are the funds the LBA tracks, and those are the funds that are perhaps with all the various appropriations that the legislature is considering during this off year. Those will be funds that could be used for those additional appropriations that were not part of the operating budget.
Representative Grassi.
Yeah, you made a statement that you could take the funds out of the rainy day fund by two ways. One is that revenues are too low or expenditures too high. But when addressing Representative Wallner's question, where she said, where did the $100 million come from? You said it was done by legislative action. So there's actually a third way we could take the money out, by legislative action.
That is correct. That is correct. It wouldn't be something I will recommend, but that is a way. You're welcome.
So this is a question for the LBA. The House passed two bills that put large expenses on the Education Trust Fund. One for just general 68 million, if I remember right, higher adequate education payments. The other one was, I think, about 18 million for special education. And I looked at the status of this. I saw the special education bill, I think, is recommended interim study in the Senate. Do you know what the other bill is?
$15.83 relative to the per pupil cost is in the Senate Finance Committee, and I don't believe they've acted on that yet.
Thank you. Other discussion on the amendment? All right, clerk will call the roll on the amendment.
So there's a motion on amendment number 1832H. Representative McGuire,
Yes.
Representative Griffin,
Yes.
Representative Sweeney,
Yes.
Representative Cambrels,
Yes.
Chair Weiler.
Yes.
Clerk votes no. Representative Lane,
No.
Representative Grassi,
No.
Representative Wallner.
No.
Already called on Representative McGuire. Okay. So it's 5-4.
All right, so our motion is now ought to pass as amended by. Our motion is now ought to pass as amended by 1832H. Further discussion on that? Seeing none,
All right,
clerk
I
can
need
call
to-
the roll. I think, yeah, Representative Sweeney. Yeah.
I need to fill out this paper. So it was McGuire, Sweeney. Okay. Ought to pass as amended. Representative Griffin,
Yes.
Representative Sweeney,
Yes.
Representative Cambrell,
Yes.
Chair Weiler.
Yes.
Clerk votes no. Representative Lane,
No.
Representative Grassi.
No.
Representative McGuire.
Yes. We're way past 2 o'clock, so we can start on Senate Bill 553. Thank you all. You leaving?
Not leaving, I just gotta go read an amendment.
Oh, okay.
You are. Okay, so you're 5.
I think it's.
Yeah, it's quick.
I think it'll be quick.
This will be quick.
Yeah.
Thank you.
I hope it's quick. Better be.
Okay. Okay. I'll probably read it.
So I asked Melissa to create a little packet of the relevant laws in case anybody would like to know, read existing law and so on. It turns out it's a little weird that this fund has been in existence since 1991, but it's only been under the treasurer since last year. It previously had been under the banking commissioner. So that may be why the treasurer doesn't have roles and things like that, right? Because it hasn't been very long. So, but in any case, the language in the law is essentially the same as it was under the banking commissioner for many, well over 30 years. So, but that information's in this. And so I guess that Representative Sweeney would like to offer amendment
1843H.
1843H. And okay, Representative Ebel will second and will speak to his motion.
Perfect. Thank you very much, Mr. Chairman. So this was the bill that we were about to interim study yesterday, and we just wanted to give stakeholders one more day to sort of discuss it with the treasurer. This amendment represents a compromise between the proponents of the legislation and the treasurer in order to make this from the original bill, which was going to mandate 100% of PDIP into invested in New Hampshire. This is an encouragement bill now that will simply ask them to strive that no less than 30% be invested in New Hampshire. But there is no requirement within this amendment or once we amend the legislation that would actually require the investment be in New Hampshire, but it will just show the legislative intent and encouragement that the fund be partially invested in the state of New Hampshire, while still maintaining that and I'll quote directly, the investment advisor selected by the state treasurer and advisory committee shall achieve and maintain the highest attainable rating for stable value local government investment pools. Right above that, we say the investment advisor selected by the state treasurer and advisory committee shall strive to maintain no less than 30% of the funds held by the public deposit investment pool in insured or collateralized deposits meet the requirements of RSA 68I and 68IA. So the real emphasis of the amendment is that their main priority is to obtain the highest attainable rating for stable value local government investment pools, and while striving to make sure that 30% meet the original intent of the bill. There is an update to the definition of ratings in the bill, in the amendment, further conversations with the treasurer that I would just want to read in to this amendment as a friendly amendment. Instead of lines 25 through 27 for the purposes, striking that and just say the credit rating is an indication of the ability to preserve principal as determined by a nationally recognized statistical ratings organization, just to provide that definition as to what credit rating in the terms of this bill is. And for Monday's meeting, I'll have an updated amendment with that directly in it. But that is, I think that we heard a lot about people wanting to protect PDIP as it is. We heard from stakeholders of the value that would be added to New Hampshire's economy with more money invested in the state of New Hampshire. I think this amendment can protect PDIP while also investing in our own economy. And it's a good middle road for the problem that's been brought forward to us. Thank you.
Thank you. Representative Griffin.
Thank you, Mr. Chair. I looked at the amendment. I'm still very unhappy with the shell strive and the 30%. I think now that we know the history of the fund and the changes in the law that were made to it last year, we should give the fund administrator and the policy committee time to develop policies on their own that may encourage investment in New Hampshire and still maintain the safety of the fund and not necessarily target a certain percentage. So I will be voting no against the amendment and supporting a motion to interim study.
Representative Kimbrels.
Thank you, Mr. Chair. In reading the amendment, I believe that this amendment is that encouragement for them to look at their policies, and it is not a mandate. Therefore, I would be supporting it.
Representative Grassi.
Yes, thank you, Mr. Chairman. I have to disagree. First of all, this bill should have went to Commerce instead of here, where they have a little more experience in dealing with banking issues and investment issues. But secondly, I think that one of the first things I think was said is that this is an agreement was reached between the parties, but it was the treasurer and the banking industry that it was reached with. Where were the cities and towns that spoke against this bill? Where were they in that negotiations? I think that one of the things that we left out, and what I've received a number of phone calls with people that I've worked with in the past, for the small cities and towns who do not have the ability to invest on their own, and get rates that they're able to get through the pool. And I think that that's the important thing, is that until we hear from them, I don't think I can support this. And I would rather see this go to interim study so that we can take a look and bring the cities and towns who opposed the original bill into this negotiation, so we can sit down and maybe we can find an agreement between everybody. But negotiations between the bank and the treasurer leaves out all those small communities that we represent.
Thank you. Further discussion? No? All right. Yeah, I'm with Representatives Griffin and Grassi on this. I tend to think this is a very successful program. All the people we spoke to who use it, like it, don't want it changed. We had another 2 letters today, one from Randolph, one from Coas County. Both say don't make any changes. I think, 30% of a mistake is still a mistake. So, so I'm going to be voting no also. All right. What further discussion, Representative Evil? Yeah.
I agreed to sign on to the amendment with Representative Sweeney, and I thank him for bringing it forward. I mean, as I read this is purely an encouragement approach, encouragement that I was persuaded was important and needed based on the testimony that we heard during the original hearing. And then as far as I mean, I'm very respectful of the municipalities. I didn't see that the New Hampshire Municipal Association took a position on this. I know they didn't. But the other important point here is if there's concerns about return for the PDIP, if you invest locally, there's a requirement here that they shall achieve and maintain the highest attainable rating for the pools. So I think that answers the return concern. And for that reason, I will be supporting the amendment.
Thank you. I'll just point out, rating here is about safety. It is not about return, as far as I am believe. And interestingly enough, none of the language in law for many, many years said anything about return. You know, it didn't say, you know, you would expect it to say, you know, achieve the highest possible return given an adequate level of safety or something like that. But it actually didn't say any of that. It just said to the advisory committee, you come up with criteria, and that's what they naturally did. So anyway, let's have a vote, I guess. Are we ready? When the clerk is ready?
Yep.
Okay.
All right, okay,
on the
so
amendment?
this
On
is
the
just on the
Vote on the
amendment.
amendment.
So 1843H. Representative Griffin,
No.
Representative Sweeney.
Yes.
Representative Cambrils,
Yes.
Representative Weiler.
No.
Clerk votes yes. Representative Lane,
Yes. Yes.
Representative Grassy.
No.
Representative Wallner,
Yes.
and Representative McGuire.
No.
So it passes 5-4.
Representative Griffin.
Mr. Chairman, I move interim study to the
What?
bill as amended.
I think we are already ought to pass with this amendment, no?
No,
No.
just adopted. The amendment is on.
I made the motion, right? Interim study with the amendment.
Ought to pass doesn't need.
I don't know. I guess I've not been a chair long enough to answer this question. Representative Weiler? Moving interim study is in order? Okay.
All right, well, I don't have a sheet.
All right. Presumably the 5 people who voted for the amendment can vote no on interim study if they want to. How do you amend an interim study?
You can't.
It doesn't make sense.
I don't,
You make
Bill is on second reading, open for further amendment. Amendment is interim study.
no, it's not an amendment, that's a motion. I don't think so.
Should I call the clerk? All right. Let me call him because, you know.
Okay.
All right.
The way we have to do this to pass. And
Let's recess until 5
If
of
that
3
fails,
o'clock.
then you interim
Thank you.
study. All right, I'm gonna get another sheet.
It's not an
And, you know, if that fails, then we can look for other motions. And if it succeeds, then the minority can recommend interim study, right? And write a blurb and all that stuff. So, okay, so let's vote on ought to pass with amendment.
Okay. Representative Griffin.
No.
Yes.
Yes.
Representative Lane.
Yes.
No. Do we have any other business today? All right, we'll see you all at 1 o'clock tomorrow. Or is it noon if we have a caucus? I'm not tomorrow, Monday. Yeah, Monday. No, yes, we do have session, sorry. Right. So we have session tomorrow, 9 o'clock caucus, whatever, 10 o'clock session. But as a finance committee, Monday at 1 or noon if you have a caucus. Full finance, all these bills. And Monday is exclusively Division 1. All 14 of our bills or whatever.